Melanoma, a word that sends shivers down the spines of many. It's a term that often evokes fear and uncertainty. It's a type of skin cancer, often considered the most dangerous due to its ability to spread to other parts of the body if not caught early. But what exactly is it? And why is it so concerning? Melanoma originates in the melanocytes, the cells responsible for producing melanin, the pigment that gives our skin its color. In this short essay, we'll delve into the world of melanoma, understanding its nuances without getting bogged down by medical jargon. We'll break down complex information into easily digestible pieces. We'll explore its causes, symptoms, and the importance of early detection. Factors like excessive sun exposure, tanning beds, and genetic predisposition can increase the risk. Knowledge is power, and understanding melanoma is the first step towards prevention and timely treatment. Early detection can significantly improve the prognosis and treatment outcomes. So let's embark on this journey of awareness together. By educating ourselves, we can take proactive steps to protect our skin and health. Remember, this information is for educational purposes and not a substitute for professional medical advice. Always seek the guidance of a healthcare professional for any concerns. Always consult your doctor for any health concerns. Your health is paramount and professional advice is irreplaceable. Melanoma originates in melanocytes, the cells responsible for producing melanin, the pigment that gives our skin its color. These cells are found in the lower part of the epidermis, the outer layer of the skin. When melanocytes become damaged or undergo genetic changes, they can start to grow uncontrollably, leading to melanoma. While most moles are harmless, melanoma arises when these melanocytes grow uncontrollably. It's important to monitor moles for any changes in size, shape, or color, as these can be early signs of melanoma. What makes melanoma so dangerous is its ability to spread to other parts of the body. This aggressive nature allows it to invade nearby tissues and even distant organs. This process, known as metastasis, makes it harder to treat. Once melanoma has metastasized, it becomes more challenging to control and requires more intensive treatment options. Early detection is crucial in improving the chances of successful treatment. Regular skin checks by a healthcare professional and self-examinations can help catch melanoma in its early stages. Melanoma can appear anywhere on the body, even in areas not exposed to the sun. This includes places like the soles of the feet, palms of the hands, and even under the nails. However, it's more common in areas that receive frequent sun exposure, such as the back, legs, face, and arms. Protecting your skin from excessive sun exposure by using sunscreen, wearing protective clothing, and avoiding peak sun hours can reduce the risk of developing melanoma. Melanoma often starts as a change in an existing mole or as a new, unusual-looking growth on the skin. These changes can include alterations in size, shape, color, or texture. One of the most common signs of melanoma is a mole that's asymmetrical, meaning one half doesn't match the other. Other warning signs include a mole with an irregular border, uneven color distribution, a diameter larger than a pencil eraser, or a mole that's evolving over time. If you notice any of these changes, it's essential to see a dermatologist immediately. Remember, early detection is key to successfully treating melanoma. Section 4. Causes and risk factors. Who is at risk? While the exact cause of melanoma is unknown, exposure to ultraviolet or UV, radiation from the sun or tanning beds, is a major risk factor. Excessive UV exposure damages the DNA in skin cells, increasing the risk of developing melanoma. Other risk factors include fair skin, a history of sunburns, a family history of melanoma, a weakened immune system, and having many moles or unusual moles. While some risk factors are beyond our control, we can minimize our risk by adopting healthy sun protection habits and being vigilant about skin checks. Section 5. Prevention is key protecting yourself from melanoma. Prevention plays a vital role in the fight against melanoma. It's essential to be proactive and take steps to protect our skin. By adopting simple yet effective measures, we can significantly reduce our risk. These measures are easy to incorporate into our daily routines. One of the most crucial steps is protecting our skin from the sun's harmful UV rays. This can be done by seeking shade whenever possible, especially during peak sunlight hours. This includes seeking shade during peak hours, typically between 10 a.m. and 4 p.m., when the sun's rays are the strongest. wearing protective clothing like hats and sunglasses, which can provide an additional barrier against UV radiation, and applying broad-spectrum sunscreen with an SPF of 30 or higher. It's important to reapply sunscreen every 2 hours, or more often if swimming or sweating. Regular skin self-exams are equally important. By checking our skin monthly, we can catch any changes early. By becoming familiar with our skin and any existing moles, we can monitor for any new or changing spots. We're more likely to notice any unusual changes that warrant a visit to the dermatologist. Early detection is key in treating melanoma effectively.